Hello guys, welcome back. Hope you all are doing absolutely fine. So today we'll be continuing with our pathology exam revision series with our next topic, that is healing. Healing is the body's response to injury in an attempt to restore normal structure and function. It involves two processes, regeneration and repair. Healing of skin wounds. Healing of skin wounds provides a classical example of combination of regeneration and repair. Wound healing can be accomplished in one of the following two stages. Healing by first intention, that is primary union. Healing by secondary intention, that is secondary union. Healing by first intention. This is defined as healing of a wound which has the following characteristics: clean and uninfected, surgically incised without much loss of cell and tissues. Edges of the wound are approximated by surgical sutures. The sequence of events in the primary union are initial hemorrhage. Immediately after injury, the space between the approximated surfaces of incised wound is filled with blood, which then clots and seals with wound against dehydration and infection. Acute inflammatory response. This occurs within 24 hours with appearance of polymorphs from the margins of incision. By third day, polymorphs are replaced by the macrophages. Epithelial changes. The basal cells of epidermis from the both cut margins start proliferating and migrating towards incisional space in the form of epithelial spurs. A well-approximated wound is covered by a layer of epithelium in 48 hours. By fifth day, a multi-layered new epidermis is formed, which is differentiated into superficial and deeper layers. Organization. By third day, fibroblasts also invade the wound area. By fifth day, new collagen fibrils start forming, which dominate till healing is complete. In 4 weeks, the scar tissues with scanty cellular and vascular elements, a new few inflammatory cells and epithelialized surface is found. Suture tracts. Each suture tract is a separate wound and incites the sample phenomena as in healing of the primary wound, that is filling the space with hemorrhage. Some inflammatory cell reactions, epithelial cell proliferation along the suture tract from collagen. When sutures are removed around 7th day, much of epithelialized suture tract is avulsed and the remaining epithelial tissue in the tract is absorbed. However, sometimes the suture tract gets infected or the epithelial cells may persist in the tract. Healing by second intention. This is defined by healing of a wound having the following characteristics: open with a large tissue defect, at times infected, having extensive loss of cells and tissue. The wound is not approximated by the surgical sutures but is left open. The sequence of events in secondary unions are initial hemorrhage. As a result of injury, the wound space is filled with blood and fibrin clot which dries. Inflammatory phase. There is an initial acute inflammatory response followed by appearance of macrophages which clears off the debris as in primary union. Epithelial changes. As in primary healing, the epidermal cells from both the margins of wound proliferate and migrate into the wound in the form of epithelial spurs till they meet in the middle and re-epithelialize the gap completely. However, the proliferating epithelial cells do not cover the surface fully until granulation tissue forms. The base has started filling the wound space. Granulation tissue. Main bulk of secondary healing is by granulation. Granulation tissue is formed by proliferation of fibroblasts and neovascularization from the adjoining viable elements. Wound contraction. Contraction of wound is an important feature of secondary healing not seen in primary healing. Due to the action of myofibroblasts present in granulation tissue, the wound contracts to 1/3 to 1/4 of its original size. Presence of infection. Bacterial contamination of an open wound delays the process of healing due to release of bacteria toxins that provoke necrosis, suppuration, and thrombosis. Complication of wound healing. During the course of healing, following complications may occur: infection, implantation cyst, pigmentation, deficient scar formation, incisional hernia, excessive contraction, and neoplasia. Factors influencing healing. Two types of factors influence the wound healing: local factors, infection, poor blood supply, foreign bodies; movement delays, ionizing radiation, ultraviolet rays, light; systemic factors, age, nutrition, systemic infection, administration of glucocorticoids, uncontrolled diabetes, and hematologic abnormalities. Thank you.